And how it has an impact on health, because I know cancer is one of your themes.
That is correct.
Yeah. And you said Tai Chi exit, huh?
What I'm trying to do.
You're on.
Okay.
Excuse me, I'm sorry. You're on.
Welcome back. I'm Dr. David Morwood, and this is your health radio and television program. Thanks very much for being here. And my next special guest, Dr. Stephanie Taylor, MD, PhD,
Yes.
Women's Medicine Specialist. Dr.
Indeed.
Taylor, thanks very much for being here.
Pleasure to be here.
So, Dr. Taylor, what I'd like to do is talk about you and this idea of you specializing in women's medicine and something about your training. How is it that you get to be a specialist in gynecology and women's medicine?
Well, you start out entering to obstetrics and gynecology. Right now, we don't have a separate specialty for women's medicine only. Historically, it was women's and children's medicine back at the turn of the other century. And then obstetrics and gynecology branched out as a surgical subspecialty. And we do think of ourselves as surgeons as opposed to internal medicine doctors.
So what's the training like to become a specialist in obstetrics and gynecology?
You have 4 years of medical school, as do all physicians. And then there's a 4-year training as a resident in obstetrics and gynecology where you function in a supervised setting, basically delivering care. And the way we select people is by the light in their eye, really. They're people who have a certain love for obstetrics and gynecology. And when I was soliciting applicants from the medical students, you could always tell who was falling in love. Because when there was a delivery to be had, half of them would step back, and there's one person whose eyes would light up, and that's the one who's going to be a specialist.
Well, Dr. Taylor, I recall from medical school the first time that I assisted on delivery and got to do a delivery, it was just an amazing event, really the miracle of life. It is amazing. If it weren't for plastic surgery, which I love even more, I would have considered going into obstetrics. So 4 years of college, and then a minimum of 4 years of residency training following that. Is that right?
Right. So 4 years of college, 4 years of medical school, and 4 years of residency training. Now, you can go further in gynecology in the sense that there's a subspecialty in endocrinology and infertility. So you could take additional subspecialization, also in gynecologic oncology.
So what's the difference between an obstetrician and a gynecologist, or is it the same thing? I noticed people specialize in obstetrics / gynecology.
Exactly. And the other subspecialization is fetal and maternal medicine. So the vast majority of obstetrician gynecologists do general women's health care and deliver babies and take care of moderately high-risk obstetrics. So the very, very high-risk obstetric patient goes to the fetal maternal medicine specialist, which are usually only in universities.
Okay. Well, Dr. Taylor, one of the things I'd like to talk about today, if we may, is one of the areas in which you have a lot of expertise in, and that's vitamins, and especially vitamin D. So could we start out by explaining to our audience what is a vitamin and what is mineral?
Absolutely. It's a subject that's close to my heart because I started out in research. Actually, my doctoral degree is in what has become neurochemistry. So I started out in biochemistry, and for the sake of your program, I counted back the years, and it's been 40 years since I started out in the laboratory doing research.
Well, fun flies when you're keeping time. 40 years.
Yes, indeed.
And I do want to point out again, you not only have an MD, you have a PhD.
PhD, right.
You're one of those overachievers.
Well, not really. Yes and no. Yes. I do like to say that Richard Nixon helped me get into medical school, and I'll tell you briefly how that came to be because it has to do with our vitamin story. I started out in research, and in the 1970s was the first year the NIH budget was constricted. And so there were a lot of us who were PhDs who were trying to find a job at university. It was not possible, so many of us went into other areas. And I'd always loved medicine, so there was my opportunity to go in. So if Richard Nixon had not done so much budget cutting on my generation, I would probably still be in the lab. So my first love is vitamins and minerals.
So tell us exactly, how do we define the difference between a vitamin and a mineral, and what are they?
It's less clear than you would think. The vitamins were discovered sequentially starting in about the 1930s, and they're just numbered by the time they're discovered, A, B, C, D, and E. They were discovered in that order. And they're not in any way identical. Vitamin A and vitamin D and vitamin E are fat-soluble vitamins, and the others are water-soluble. They are necessary nutrients that we cannot make ourselves. And so we need to get them in our foodstuffs or as a supplement.
Okay, so they're vitamins, they're a molecule, right? I mean, it's a nutrient.
It's a nutrient.
That you said we can't make it ourselves, so we have to take it in.
We do. The vitamins are complicated. Minerals are easy, and minerals are easier to understand. Calcium, magnesium, selenium, they're the things that are on the periodic table of elements.
So are all minerals elements?
Pretty much.
For example, iron.
Mm-hmm. Yeah.
Okay, so those are elements like we could find in the ground, in the earth.
Exactly. Yep.
And vitamins typically we get from food?
From food. They're much more complicated than the minerals are. And they're not all identical, and that's why the vitamin D story is so exciting right now. Vitamin D is actually a pro-hormone, and it's become apparent that 50% of the population is deficient in vitamin D, and that's incredibly important, particularly the farther you go north and you're away from being sun exposed. Vitamin D used to be called sunshine vitamin, and there are people in your audience, I'm sure, who might remember their grandmother giving them cod liver oil in the winter, and that was how people got their vitamin D before we had much research on it.
So I think I just heard you say that up to 50% of the population is vitamin D deficient.
They are, because the guidelines have changed. In the last year to 18 months, the recommended daily allowance of vitamin D has been adjusted upward from 400 international units to 1,000 international units. And blood levels are becoming more important to monitor the status. And so the deficiency that we're talking about in the population has been verified by blood levels. So the blood levels are low in a huge proportion of the population.
Okay, well, Dr. Taylor, this sounds like it's a huge, we have a potential for a huge public service.
Yeah.
So what is it that vitamin D does? Why do we need vitamin D?
Yeah. The original story was that vitamin D prevents rickets in kids. And a lot of the vitamins recommended daily allowance were set for children to prevent deficiency diseases, such as pellagra and beriberi, and rickets. Rickets was not uncommon.
Okay.
Bowed legs, right?
So the rickets is crooked legs that we all remember or have seen pictures of in medical school. That's the bowed legs, and it's not so common these days.
No.
But rickets can still be seen if a child is vitamin D deficient.
Exactly. And the amount that you see on the back of the vitamin bottle is the amount that you need to prevent rickets. The amount that you need as an adult is different. And that wasn't recognized until recently because there was a great fear of people taking too much vitamin D because, like the other fat-soluble vitamins, it can be taken in excess and cause problems. But the revolutionary thing is that the amount adults need is different than what we thought. So it used to be 400, but now we know it's 1,000 at a minimum, and sometimes 2,000 in certain situations.
Okay, so this sounds so vital and important. Do we know how to get vitamin D? Should we all take a vitamin? Are there certain foods we should eat, something we should drink?
Right. It has been in milk for a long time, but most people don't get enough of that in their daily diet, so really taking it as a supplement is the most prudent way to go. And to go back to what we were talking about, why D, right? It was originally supposed to prevent rickets, but it's become more apparent that vitamin D has a number of different effects. It has an immunomodulating effect, and because of that, it has an impact on the development of different cancers and autoimmune disease. It has a role in the development of multiple sclerosis that is very interesting.
Now, I just we need to explain the immunomodulation.
Yeah.
And it has a role in immunomodulation. What do we mean by that?
That's a word that we use when many things are happening and we don't have time to describe it. The immune system is incredibly complex. And so vitamin D both improves and dampens down the immune function. It tightens certain things and it dampens down the overall inflammation. Inflammation is generally bad, and it promotes cancer and heart disease. Vitamin D also increases the activity of the beneficial white cells. And that's just as a preface to say that it has a dramatic effect in preventing cancer. If you look at large-scale studies, if you compare people who are vitamin D deficient to those who are not, there's a dramatic increase in colorectal cancer and breast cancer in people who are vitamin D deficient. Also, consequently, you can reduce these diseases, both colorectal and vitamin D, colorectal cancer and breast cancer, by bringing the vitamin D level up to the upper limit of the normal range. And the improvement's dramatic. I mean, people argue in the literature about 10 or 2% improvement, but we're seeing 40, 50, and 60% improvements just with the vitamin D supplementation.
Well, Dr. Taylor, see, that's amazing to me.
Yeah.
Now, I want to ask you a question, of course. Is that in peer-reviewed journals? Is that good scientific data that we can rely upon, or is that theory now?
Published in the major journals. Yeah, indeed it is. The Journal of the American Medical Association, the cardiovascular one, was published in Circulation, which is the official publication of the Cardiology Association. Yep.
Okay, so see, I'm going to learn a lot in this segment, as I do in most segments. Does that mean that adults should be taking vitamin D supplements?
Yes. The official recommendation is that you have to take it as a supplement. You can't rely on sun exposure because it depends on the time of year, and also depends on use of sunscreens. And so you're balancing out the risk of a skin cancer with getting enough vitamin D.
Okay, so earlier in the segment you mentioned that what used to be called a sunshine vitamin.
Yeah.
So the sun is related to the pathway of the vitamin D, or we can actually make vitamin D?
You can actually make vitamin D in your skin from sunlight.
Okay, so for adults that, well, you're suggesting that perhaps all adults should take vitamin D supplements.
True, and the recommendation historically has been for 100, but now it's 1,000. And there's no way really you're going to get 1,000 international units from your daily diet. You will get vitamin D in fatty fish. It's present in mushrooms, of all things, and in cod liver oil, which is not popular.
Okay, well, I have a question for you. You mentioned that vitamin A, D, E, and K, those are the fat-soluble vitamins. And B and C, those are the water-soluble. So it means if you take in too much, you can either sweat or pass your water, and you excrete these vitamins, the water-soluble. But fat-soluble vitamins can actually build up within you. Now, can we overdose on vitamin A and D and E and K? Can we? Absolutely,
yeah. If vitamin A has been a real issue because you can easily overdose on it, and right now it's very tightly regulated as in multivitamins. And if you take the precursors, they're considered to be a lot safer than the vitamin A itself. The vitamin D is, of course, been taken not enough, as we now know, and vitamin K actually is not usually in a multivitamin. You know, vitamin K is synthesized by your body, for the most part.
Well, that's amazing to me. Okay, so let's summarize. So there's good data that indicates that sufficient levels of vitamin D will actually lower your risk of certain cancers.
Yes.
Okay.
Absolutely.
And we typically, or in the past, have thought that the minimum recommended daily allowance, or the RDA, was for children to prevent rickets. But for adults, it seems that we need more than what kids do. What kids need.
You do. And all adults need a little bit more as they get older because their utilization and absorption is not as efficient. Also, for example, people who've had bariatric surgery are very poor absorbers of vitamin D, and so one of the unfortunate side effects is that they develop osteoporosis fairly easily. And so folks who have any kind of malabsorption, whether it's from bariatric surgery or if it's for another disease process, need extra vitamins and probably need to have blood monitoring.
Okay. Well, Dr. Taylor, you just raised another issue, and, you know, this is a surprise. I want my audience to know that we didn't talk about this ahead of time, but you brought up this idea of osteoporosis, and that being related to vitamin D and estrogen.
Right.
Can we talk about that briefly? Do we have time? So what is it? Maybe we could start by explaining actually what is osteoporosis. I mean, you can barely turn on the television or pick up a magazine without hearing that word, but I think most of our viewers don't understand what osteoporosis is. Could we talk about osteoporosis just briefly?
Oh, yeah. Osteoporosis is a decrease in the calcium concentration of the bone. And I say it that way because that's how we measure it. We use a machine called a DEXA scan, and calculates out the grams of calcium that are present in bone tissue. It doesn't tell you about the structural integrity of the bone, which is its resistance to lateral fracture. That comes with exercise, and I think probably when we get more sophisticated ultrasound, we'll be able to measure that. So this is a thinning of the bone, and it makes it more subject to fracture. Now, bone has two parts. One is the bone isn't solid, otherwise we would all be too heavy. It has structural sort of struts that are on the inside. And those struts can be thinned and or fracture, and also the outer cortical bone can also become thinned. And that makes the bones more likely to break. The other thing I should say, too, about, which is the odd thing about vitamin D, is that it has to do with muscle strength. And there's great controversy in osteoporosis about whether or not the bones break and you fall, or if you fall and then you break the bones. So if you never fall, would you fracture, right? Because as people become more unsteady on their feet, they're more likely to fracture. But you could have fairly profound osteoporosis if you never fall or traumatize the bones. You wouldn't necessarily fracture and know it. So they're closely linked.
Okay. Well, how does estrogen and vitamin D play a role in osteoporosis?
There are small cells that make bone grow and make bone remodel. And both of those things help the bone growing component. And as you get older, like all things, they aren't quite as lively as they used to be.
Okay, so does taking vitamin D supplements and or estrogen, can that be reversed, or can osteoporosis be reversed or not?
We used to say cardiovascular disease can never be reversed, but now we know that it can. We always said that osteoporosis can't be reversed, but I think that it can be, and some of it can't be accurately measured. You can increase the mineral density of the bone using calcium, vitamin D, estrogen, and using prescription medicines. Whether or not the bone is more resistant to fracture is another matter, and that's something we can't measure. So really, you can build better bone, might not be able to measure it.
I see. Okay. Well, Dr. Stephanie Taylor, MD, PhD, we just have about a minute, and so I want to give our audience your phone number or website, and then I have a little surprise question for you. So do you have a website or phone number that we can?
Yes. Our phone number is 622-1995, and we have two websites. But let me direct you to the one that we do for fun. It's Woman's Wellspring, WOMANSWELLSPRING.com. That's our Tai Chi website, because I'll tell you, the longer I practice medicine, as you can tell, it's been a while, the more I appreciate that exercise and nutrition are critical to good health. And so my new night job, now that I'm not delivering babies, is to teach Tai Chi.
You see, you took my surprise away. I was going to ask you to talk about Tai Chi. So once again, Dr. Stephanie Taylor, MD, PhD, you're right here in Monterey.
Yes.
And that's womanswellspring.com. And that's woman, W-O-M-A-N. And Taylor is T-A-Y-L-O-R.
That's right.
Dr. Stephanie Taylor, MD, PhD, specializing in gynecology and women's medicine. Thanks so much for coming on the program. Sure appreciate it.
Oh, you're welcome.
I've learned so much about vitamin D. I think I want to go home and take some.
Take some, right.
Thanks very much. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. We're going to come right back after a very brief pause for a very good cause. Thanks for being here.